YouTube. So we're going 3 live. Hello there on Instagram, T Worth. Boy, I got people jumping on. Hey guys. So this is going to be a live Q&A. I'm doing Facebook and YouTube and Instagram all at once. So we'll see how this works. Could be interesting. So if you've got questions, you can put them in the chat, which I think also works on Instagram. So bear with me. If you put a comment, especially on Instagram, put a comment if you can see me and hear me. If it sounds okay, if it looks okay. Let me know that you're there. And I'm going live over here on Facebook. I think I'm live here on YouTube. I can't tell for sure. It says I'm live. And cool. So let me see. See if I can find myself on YouTube so I can answer questions. Wesley Ski. If you don't know, my login on, thank you there, Janice. Thank you. My account on YouTube is Wes D Ski. That's the easy way to find it. I have a ton of YouTube videos on there. So if you're curious, you can check those out. Lots of questions, lots of answers. I'm just trying to make sure this YouTube thing's going live too. So sorry, I'm doing like 3 things at once. Why am I not live? It says I'm live. It says the internet can totally see me. So hey, thanks guys for telling me. It looks great on Instagram. Hey, Alyssa over there on YouTube, or sorry, Facebook. That's where you are. If you have questions, put them in the comments and or put them in the chat, and I'll answer your questions. I've got 3 streams going at once, so I'm a little confused about what's going on, but I think it's all working. It says it's running. So, hey everybody over on Facebook. It's Monday. I know it's not Friday. It's really weird. But my Monday kind of got strange and I had the afternoon off and nobody's in labor. I delivered all the babies. So here I am. So if you have questions, put them in the chat. There's people watching. Hey Shayna, how's it going? Put something in the chat, Shayna, so I can see if it's working. I don't know that there's questions are popping in on Instagram. Somebody said looks great, so I think it is. And I'm waiting to see if YouTube comes up. There it is. It says it's live. People are watching. Okay. Oh, hey, let's see. I do have comments over here. Hi from Germany. Holy cow. So somebody's watching from Germany. That'd be Alana. Sorry, I didn't get that working earlier. So if you guys have questions, put them in the comments and I'll answer them as we go. Got a question. Biggest problem, periods are 18 days late. Not pregnant. What to do? Okay, so kind of how do you evaluate a late period? Well, the big question, of course, is this a one-time thing? Is this a recurring theme? So if it's a one-time thing, I kind of wait a couple weeks, see what happens, and you may get your period. The other question is, if you're taking medications like birth control pills, some birth control pills can also make you just not have a period. So it could be that as well. If your periods are frequently irregular, like you're missing them every other month or something like that, that's a whole different deal. And then it's kind of how do you do an evaluation for infrequent periods, which actually Carla asked in the comments just a couple below Amir. So one of the big things is there's sort of some medical things that can cause infrequent periods, mostly checking thyroid and a hormone called prolactin. If those 2 are normal, then you start thinking more along the lines of just ovulatory dysfunction. A lot of those folks have, there's some PCOS in that category. Some medications can make your periods irregular. So the big question for Carla is, and Carla, if you're still there and listening, you can put it in the chat there. Are you trying to get pregnant or not? Because that really tells you what the answer is. Because if we're managing it okay, we got questions popping everywhere now. This is great. If you're trying to get pregnant versus trying to not get pregnant. So tell me, Carla, if you're still there, if you're trying to get pregnant or not, because that's going to change my answer. All right, Shayna says, should adults get a measles vaccine booster? Just curious with the recent outbreaks. And it's a great question. And the short answer is, so far, the CDC has not given us a straight answer for what to tell everybody. Now, a generic answer to that question is you could just simply do a titer. So we can draw blood and we can see if you're immune to any of these. So measles is a classic example. You can do a measles titer. And if it shows you're immune, which most people would be who have received the vaccine earlier in their childhood, are probably immune. But the the titer would confirm it. And if you're immune, you're good. Don't worry about it. And if you're not immune, you get a booster, and that's the MMR. And that's what I would do if I was curious about my immunity status. And I think that if we see it popping up in Utah and people start asking questions, the academic answer is get a titer. The easy answer is just get a booster and don't worry about it, because there's no harm in getting the booster. So either way is perfectly fine. Hopefully that answers your question, Shayna. Thanks for your question. That's the first live question on Instagram. High five, Shayna, for that. And then let's see. Are there other options other than an epidural? So there's a video on my YouTube channel that talks about water immersion in the first stage of labor. That is before you're completely dilated, before you're pushing to deliver. And there's a pretty good study that shows that getting in the tub, water immersion, which both hospitals offer that we work at, does reduce the need for an epidural. So I think that's a good one to consider. And I talk about it on my YouTube channel. If you guys, you may not know if you're following us on Instagram, but if you just go to YouTube and type in West D Ski, I'll pop it in here. There you go. Bam. If you go to YouTube, pop in West D Ski, you'll find the channel. There's a video on there. It's got a pretty funny thumbnail of me holding some scuba gear, so you can check that out. All right, so thanks for the second question ever on Instagram Live. Okay, we're going to jump over here to Facebook. Mary said, what's your opinion on castor oil to induce labor? I don't recommend it, I'll tell you. First off, it's not terribly effective. Second off, it causes horrible diarrhea. Some of the worst diarrhea I've ever seen in my life was people who've tried castor oil. It's terrible. It may lead to some dehydration, and that may cause some contractions, but very few people are actually going to labor off of it, but man, they'll be miserable. So I don't recommend it, but thanks for your question, Mary. If you're curious about induction of labor, there's a video on my YouTube channel that talks about this question, and there's a recent study called the ARRIVE trial. And in the short version is it reduced the risk of C-section and reduced the risk of preeclampsia, so blood pressure related complications, in the group that was induced from 39 to 40 weeks in first-time moms. So if you're curious to learn more about that, check out the video on my YouTube channel. But we don't use castor oil. We use just like either Pitocin, or we might use a Foley bulb, or we might use something called Cytotec. But any of those are fine. So check that out and let me know. By the way, if you're watching on Facebook right here, let me know how it sounds and how it looks, because I'm doing a different stream source today for that, because I've got 3 streams going. So comment in the chat on Facebook, please. How's it sound? How's it look? Thank you very much. Okay, let's see. We've got a lot of questions on YouTube, so let's see what we've got here. Carla said, been off birth control for 2 years. If you're trying to get pregnant, Carla, sorry, I was away there for a minute, but oftentimes we're talking about either Clomid or Femara to induce ovulation. And there's a video on this YouTube channel you're watching right now that talks about that. It's called How to Take Clomid or Femara. And I just basically walk through the whole process on that video. So check it out. Let's see. Shaley had a C-section a month ago, had to pediatric because the number wasn't working, and just wondered what could cause that. Basically, the gist is epidurals are weird, and sometimes they don't work all the time. So it does happen. It's not terribly common, but you see it a couple times a year. So it's just one of those things. Epidurals are weird. Bethany says, looks and sounds great. Nice haircut. Thanks, Bethany. Yeah, see, I told you I was getting my haircut. All right. Let's see. After coming off birth control pill cycles, yeah, just never went back to normal. I'd think about Clomid or Femara. Carla, check out that video, and I'll talk about it in detail. Paige said, I did my first C-section. You had your third C-section a year ago, quite a bit of scar tissue. Yeah, so Paige is asking, you've had 3 prior C-sections. What do you think about number 4? I will tell you, there's some definite risks to that, and they relate to not only the scar tissue, like you mentioned, that you have, but a specific placental abnormality called placenta accreta. So, and it's a big deal. It's really risky. It can even be life-threatening. I generally make sure people really understand that before they go to that baby number 4, because the risks are legit bad. There is a video on my YouTube channel, again, that talks about it in more detail. If you're curious, you can check it out. Let's see. Ashbo Jenkins said, long one, sorry. 2 babies without an episiotomy and tore. Second baby tore kind of different ways. Question is, should you just be cut? No, we don't recommend routine episiotomy. There's a study that looked at this and actually showed that the damage that is done is worse after an episiotomy than if you just tear. So unfortunately tore badly, but the evidence would suggest that you would tear worse if you get cut first, if you have an episiotomy first. So we don't recommend it. It actually causes more harm than good. Okay, let's see if any other questions have popped up on Instagram. Oh, here's one. What are some more permanent types of birth control? Pregnant, second baby. Sure, this is your last. Get cysts, don't like hormones, would like something permanent. Yeah, so, tubal sterilization certainly is what we do. And then if you're a urologist, then, people do vasectomies, and either one of those would be just fine. Those are the ones that are permanent. Let's see. Glad you have a video for other options, so I'm going to go find it. Sweet, cool. All right. Let's see. I think I'm all caught up on Instagram. We're good over here. Here we are on Facebook. Cramping that keeps you awake at night, 22 weeks, third pregnancy, should be concerned. So the general question is like, I'm having a fair amount of contractions and I'm pregnant, obviously. Is that good, bad, or indifferent? What are my thoughts on that? So the general theme that I give people is, first off, the more kids you have, the worse it gets. That is a fact. So third baby, you hear about it all the time. I'm having way more contractions now than I was last time or the time before. And my thought on that is that the uterus is just a big muscle, and the more kids you have, the stronger it gets. So standard labor precautions. If you're feeling those contractions every 5 minutes for an hour, then it's potentially concerning, in which case you should go to labor and delivery and get checked. If they're less frequent than that, if they stop when you rest, don't worry about it. It's really common, and especially by the third pregnancy. So yeah, Katie, you're not alone. I get that question every day. All right, good question. Let's see, getting a bunch of stuff on YouTube here. Thanks, Shayna. Go back to work. Hey, Shandy, how's it going? Let's see. Feel the beat. Can I continue to do your cardio Zumba? Yeah, that's perfectly fine. Cardio Zumba is good. The more active you are, the better. Alana says 2 C-sections. One was for breech. Second one because baby didn't tolerate labor. Wants to try for VBAC. Calculator has you at about 70. Yeah, I think the benefits outweigh the risks. There's a video on my channel talking about VBAC after 2 C-sections. Our college supports it. And the risk is maybe slightly higher of uterine scar rupture, but it is a small increased risk. So maybe it goes from 1% to 2%. So it's not a huge increased risk. And particularly for someone who's thinking you might want to have more kids after this one, then it's even more important that you try for the vaginal birth, because you sure don't want to do 3 and 4 C, or 3-4 C-sections is where the risk starts to go up. Hey, Island Girl from Italy on a Monday. You're right. Yeah, I'm just mixing it up. I had a weird day today, so. Let's see. Miss Amir says, not taking pills, cycles 32 days, first time periods are late, and you're trying to get pregnant. Yeah, so, thanks for the additional info. If you're trying to get pregnant, if it's a 32-day cycle and it's a one-time thing, I'm not too worried about that. You could look for evidence of ovulation, either with ovulation predictor tests or cervical mucus, for example, and those are both reliable indicators of ovulation. So you might think about looking at those. And if you're seeing reliable indicators of ovulation and your cycles happen to be 32 days, then I don't think that's anything to worry about. So it's more about like if you're not having regular periods. So good question. By the way, on YouTube, if you don't mind, please put in the chat, how's it look? How's it sound? I've got 3 streams going at once. I have no idea if the quality's any good or not. So let me know how it looks to you guys, because it says over here my stream health is like orange, which I don't know what that means, if that's good or bad. I think it's probably not ideal. So let me know, guys. Okay. Let's see, we got another one here about periods kind of moving around, 26 to 28, now 30, which never happened. Please, why? It's all about just how frequently you're ovulating, how regularly you're ovulating. Good and clear. Thank you very much. Music, feel the beat. So kind of like I was just saying a minute ago, looking for evidence of ovulation is really the most important thing with ovulation predictor kits or with cervical mucus. Those are the 2 most common. Trying for a couple months. And yeah, so you're not doing anything wrong yet there, Miss Amir, I don't think. There is a video on my channel that talks about it in more detail. It talks about how to maximize your natural fertility. So I would recommend check that out. Thanks to the office for saying Facebook looks good. All right, sweet. So this is streaming on iPad Pro. So that's working out okay. It's got a new camera, so hopefully it's good. Leah, hey Leah, how's it going? Allergies while nursing was the best thing to take. Yeah, if it's nasal allergies, then I would use like Flonase, the nasal stuff. That won't reduce your breast milk supply. Any of the antihistamines, in theory, could, which is kind of a drag because those are the things that work the best. There is that leukotriene inhibitor, the name of which I can't think of right now. It's not Claritin, it's not Zyrtec, those are antihistamines. If you Google leukotriene inhibitor, you'll find it. Maybe I can Google it real quick. But there is this other antihistamine it's not an antihistamine, but let's see, leukotriene inhibitor. I think it's mostly for asthma, but you could try it. It would be okay. I would prescribe it. Singular. It's mostly for asthma, but it says relieves allergy symptoms. Yeah. And also used for allergy attacks. So there you go. Singular. That's what I would try, Leah. Singulair. Boom. How about that? Googled it for you. Okay, let's see. Going back here on Instagram, got some questions. Hey guys, thanks for jumping on Instagram. This is the first live for Circle of Life on Instagram. I'm also going on Facebook and YouTube, which is kind of nuts because I've got comments popping up everywhere. And thanks to everybody for your comments, and I will get to them. Let's see. Miss Tiffany on Instagram says, where can I find written information about taking the Tdap booster after 5 years being around the newborn? Want to show family members. Miss Tiffany, we have it at the office. So if you're seeing us at the office, ask for a copy. We have it at our station. I kind of think everybody has it at all their stations, but if not, swing by my station. We've got it there. I don't know where we got it offline, but we have it at the office. Let's see. What are the tests to find out the baby's sex before the ultrasound? And how accurate are they? It's a good question. So, online there's this gender reveal company now, like $75, and they'll tell you the gender. It's DNA based. They use the same PCR technology that we use for screening for Down syndrome and stuff. So I think it should be just as accurate. I don't know the company. I've tried to research it a little bit, but they say they're using the PCR technology, so it's the same stuff we use. It's just way cheaper because they're just screening for the Y chromosome. And so basically, if you see the Y chromosome, it's a boy, and if you don't, it's a girl. So that's out there. I think it should be just as accurate as any other DNA test. It's $75, and I think you can find out in a few days. So if you do it, post to the Instagram. Let us know if it was right or not. We'll do a one-person survey. Allie Mae, not sure if this is something you can answer, but what would cause crazy weight gain, lower abdominal pain, hard upper stomach, off and on, bleeding for 3 months, blah, blah, blah. I don't know if I can answer that on a live broadcast because that's kind of a complicated question, but my answer would be come see us at the office. We can definitely check all this stuff out. That's a lot to cover on a live broadcast. I don't think I can really address all those questions, but come see us. Absolutely, we can address it in the office, no problem. Okay, let's see. In Downer 6. I know I have fibroids, constantly bleed, put on birth control. Bleeding isn't stopping. What's something else you can do to do surgery, or at least until you can choose to do surgery? Yeah, so there are other medications out there that are available. There is evidence that they reduce the bleeding and possibly bulk-related symptoms. One of which is Lupron, which is a shot. It's good for like a month to 3 months. And there's a new one. It would be off-label use, but would be perfectly fine, called Elagolix. And there's another. Oh, and by the way, Ash, there's somebody on. You can't see this because it's Facebook and that's Instagram or YouTube or whatever, but that's Instagram. The name of the test is called. What did she put it right here? Sneak peek test. You can Google that. But anyway, there's oral medications for fibroids that are available, one of which is Lupron. Another is Elagolix. And let's see. I forget the name of the other one. I'll Google it. I so love Google. But at least I know what's garbage and what's not. You can do, by the way, so I don't forget, you can do uterine artery embolization, which is where they inject the blood vessels that feed the fibroids. You can do that and still try to get pregnant. But there's another pill. I was just reading about it, and I'm trying to find it. But I've got like hang on, let me go on uptodate.com. There's another medicine out there, and I can never think of stuff while I'm doing live broadcasts, so I feel like an idiot right now. Let me see if I can get logged on. Log in. Sorry, see, this is how we do it. We just Google, hey, Kayla, by the way, 2 months postpartum, having horrible pain from your groin down the front of your leg to the side of you need to come in and get us to check that out, Kayla. Let's make sure that's not a blood clot. Come in today. Are you in Wyoming? Or are you here? Let me know. Fibroid. Hang on, I gotta get this fibroid medication. Medical therapy. There it is. Ulipristal. Ulipristal. It is approved for treatment of fibroids in Canada and in the European Economic Area. No wonder I couldn't think of the name of it. It's not one I use every day or ever. Rare cases of liver toxicity, 1 in 100,000. Required liver transplant. That's kind of not good. So you're supposed to pre-screen for liver disease, monitor functional liver function tests before, during, and after, blah, blah, blah. FDA appears to be requesting additional information. So although that's not available here in the U.S., you could still do Lupron or you could do Elagolix. So hopefully that answers your question. Kayla in Montana, go to like a local urgent care and get evaluated because you want to make sure it's not a blood clot. That's a thing. It's a big deal. So get that checked out, please. Allie, what's the copay for self-pay patients? I don't know. But you can call the number 801-337-5800, or you can text the nurse and they can probably tell you. There's Clarissa's. Hey, Clarissa, if I could talk. There's the billing department number right there. You can call it and they can tell you. That's awesome. That was awesome. Thanks, Clarissa. Have yeast infection? Is there an over-the-counter? Yeah, so over-the-counter, I'd try like Monistat. Any of those like over-the-counter treatments are fine. And then if it doesn't get better, come see us. All right. Let's see. Always wanted to have a boy. Is there anything you can do? Even if it's a wife tale. Yeah, there's actually a video on my YouTube channel that talks about this. There's nothing you can do that works. So I talk about the Shettles method, which is a thing that doesn't work. There's all this different stuff. None of it works. You can do in vitro with pre-implantation genetics. It costs you about $15,000 and you can get a boy. Or you can do sperm sorting at a couple different places, one in California, one on the East Coast, for about $3,000. And that one will get you about 85% of what you want. But IVF can get you 100, assuming you make a boy out of the in vitro. So let's see. Here's a question. Mommy group, 30% use sneak peek. Wrong. Wow. That's way higher than I said. It had to be super clean area, so forth. Yeah, there could be some problems with how they're processing the samples. But that's good. Thanks. I'm not sure, Mac Brewer, what your actual name is. Sorry, because these are all screenshot or screen names. But thank you for that. I've not had that many people try it yet, so that's less accurate than I would have hoped for sure. All right. That's good. Okay. Well, hey, if you're jumping on Instagram, what the heck is this? It's Wes Davis. I'm one of the Doctor Circle of Life answering your questions. So put a question in the chat. YouTube's lighting up. Let's see what we got going on over here. Giselle says, how's it going? It's going great. Thank you very much. We're having a really good day. Quick question. Period was April 18th. When do you think you approximately ovulated? Generally about 2 weeks before the first day of your last period. That's how it usually works. KDB, do you think methylfolate is better than folic acid? There's all this stuff. Not really. It's probably not. I don't think it's wrong. It's not going to hurt anything. But it's probably not any better than just regular folic acid. Let's see. Alana, do you have any hopeful stories of women who've had successful VBAC after 2. Yeah, absolutely. I did someone's delivery within the last 6 months that had 2 prior C-sections and did absolutely great. There's evidence there. So beyond just my own like personal experience, the evidence is there to support trying a vaginal birth after 2 C-sections. So there's a video on my YouTube channel about it. If you're curious, you can check it out. But I have personally done it, and it has gone well. We know the risk is a little bit harder or a little bit higher after 2 C-sections than 1, but not by much. So maybe it goes to a 2% risk instead of a 1% risk. So I definitely encourage, if you've had 2 prior low transverse C-sections and you want to try for a third, it's certainly very reasonable to consider as long as you understand the risks, which are not that much increased. Let's see. Other questions. Would there be a reason to have so many clots, and is it as bad if you have a clot larger than a hand? I'm thinking, was this the same person? Yeah, fibroids. Yeah, so if you have uterine fibroids, that's why your periods are so horrible. So that's probably all that's going on there. And is it bad? Only in the sense that, that means you're bleeding a lot. And so you could eventually become anemic from all that blood loss. So I would definitely be taking an iron supplement, and then think about one of the medical things we were talking about earlier to help manage your fibroids. Sorry if the plane's making a bunch of noise. They're flying from the Air Force Base today. Let's see. Allison says, had a miscarriage back in October. Sorry to hear that. And not had a regular period since, not ovulating. Any advice? Sometimes folks just need to take a little Clomid or Femara to get their cycles going. I don't know why it would happen after a miscarriage versus any other time. But that may be all it is. There's some basic blood work that I would typically recommend if you're not having periods for several months like that, including checking your thyroid and also checking a level called prolactin. There are some medications that could also mess with your periods, so I don't know if you're taking any meds or not, but those kind of things. And if all those are normal, then yeah, I'd just start a little. I'd start a little Clomid or Femara and see if that does the trick. Let's see. Hey, if you're watching over here on Facebook, if you have a question and I haven't answered it, repost it, because sorry. Hey, there's the front of my desk. Not very exciting. It's my wife's desk, actually. But if you have a question that I haven't answered on Facebook, redo it, because I don't think I'm missing anything. Sneak peek is the gender test. You did it. Found out you were having a girl. This is Chandra, and it was correct, so that was good. Cat's driving my wife crazy. C-section a month ago, had to be put under. Yeah, we talked about that. I think I'm all caught up on Facebook, guys. So if you have a question, hit me up. Let's see. Mitchell and Serena, repeat C-section 2 weeks ago. Small hard lump under the incision. It's probably just the suture. It's probably nothing to worry about. If there's no redness, if there's no drainage, it's probably just where especially if it's at the edge, like the right edge or the left edge, it's probably just the suture. From Ghana. Wow, someone's watching from Ghana. That's amazing. 30 years old, married 7 years, can't get pregnant, no improvement. What should you do? That's a long answer. I would recommend that you check out, there's a video on my channel about, it's called Evaluation of Infertility, and I talk about it in a lot of detail. So I would go look at that video. But for everybody else who's watching, if you're curious, like what's the quick gist of it, it's evaluation of sperm, ovulation, and tubes. Those are the big 3. And all the tests that we do primarily focus around those things, and then considering, could this be something like endometriosis, for example. So that's the gist of it, but go watch the video. It tells you in a lot of detail. There's some images you can check out what some of the tests look like and all that kind of stuff. So check it out. Let's see. Elena, 34 weeks pregnant, wondering if you can do anything right now to help baby turn. It's laying in there sideways. You've had 1 C-section. Is there anything you're concerned about? Hoping he turns on his own. If he said, yeah, he. So personally, my routine is I evaluate that kind of for the last time at 36 weeks. And if the baby's not head down, then at 37 weeks, I would plan to try to do what we call a version, so external cephalic version, where you just turn the baby. It works pretty well, especially if it's already sideways, because you're halfway there. But there's nothing you can do personally. Like there's no home remedy for what we call malpresentation, so the baby's something other than head down. But there are things we can do to help you. So, I would look at it at about 36 weeks and see what's up, and go from there. Katie, risks while taking Zoloft while pregnant. Not much, really. And there is a video on my YouTube channel that talks about it in detail. So I would go look at that. It's called SSRI use in pregnancy. But the gist of it is there's no definitive increased risk of any birth defect. There were a couple studies probably, 15 years ago looking at Paxil that said maybe slight increased risk of certain heart defects. But that was really it, and there's really not been anything since. So the overall impression, if you read kind of more summaries of all these studies, is we're really not thinking there's any significant increased risk of any particular birth defect. Or if there is, it's very slight, so we don't worry too much about that. The main thing to know is that when a baby is born whose mom was taking any of these antidepressants, really just any of them, not just Zoloft, but anything, there's a chance the baby's going to come out and just act kind of weird. It's not dangerous, but it's unnerving if no one warned you about it. So I'm telling you now. They come out and they just kind of lay there. They might cry, they might not cry. They might just sit there. And they might be just a little bit floppy, like their tone's not really good. And they kind of stimulate the baby, and then the baby cries and moves around, they're fine. And then they kind of drift off again. And then they look over at you and they say, hey, now what meds are you taking again? And you say Zoloft, and they go, oh, that's all it is. It goes away. It resolves on its own. So it's not a reason to not take your antidepressant. And it's clear that if someone has bad depression, it's way more dangerous to not take your meds. So I definitely don't advise stopping meds, particularly in bad depression. Now, if you've been stable for a long time, a couple of years or whatever, and you're thinking about getting pregnant and you're just wondering maybe I could stop this before, I think that's fine. I think you have to taper down. So you can't just stop right away because the withdrawal symptoms are unpleasant. So you got to work your way down, and it can take a while. So it's okay to taper off if you've been stable. I'm just hitting over here on, hey, I'm waving to people. Hey. I think I'm still caught up. Hey, if you guys have any questions on Instagram, just throw a comment in the chat. I think I'm all caught up over there, though. Okay. I think I'm all caught up everywhere, except we got one here. Allie Mae, what causes postpartum hair loss? Okay. It's this thing right here. I'm going to write it down. Is that back? It is backwards. I can't write that. TE. I know it's backwards because it's doing like selfie thing. If you Google TE, telogen effluvium, that's what causes postpartum hair loss. And the gist of it is that when you're pregnant, your hair follicles go into this sort of resting stage where they just continue to grow, and they don't go into a shedding phase. That's called the telogen phase. And then when you deliver, all those follicles, all those hair follicles that were just hanging out, go into telogen, and that means they fall out. Well, the hair does. The hair follicle doesn't actually fall out. But the shaft of the hair falls out, and then it's got to regrow. And so you have this massive hair loss after you deliver. And people are like, it's like I'm pulling out handfuls of it. You ought to see my toilet. You ought to see my bathtub after I take a shower. There's hair everywhere. It's normal. It will come back. It can take up to a year. So don't freak out. It's TE, telogen effluvium. Not a big deal. I get that question like once a week, though, so you're not alone. It's very, very common. All right. Giselle, is drinking soda when 8 to 10 weeks pregnant okay? Well, I mean, there's better things you could be drinking. But if you said, yeah, but if I don't have like my one Dr. Pepper a day, I'm going to murder somebody, drink it. It's not that big of a deal. If you look specifically at caffeine, I'm not talking about soda. I'm just talking about caffeine. So tea, coffee, soda, whatever. If you get over about 50 milligrams a day, which is more than about 1 cup of coffee, you do have a little bit of increased risk for childhood obesity in your offspring. So we don't know why, but there was a study, and there's a video on my YouTube channel about it, that talks about this, and they basically correlated the amount of caffeine intake with the risk of childhood obesity. And if you were over 50 milligrams a day, they could detect it at 3 years, higher risk of childhood obesity. If you were over 200 milligrams a day, there was a detectable effect at up to 8 years of age. So it's pretty crazy. That's a pretty profound, lasting risk for someone. So I try to keep it under 50 milligrams a day, and less is more. So, but I understand, like, man, if I didn't have my cup of coffee in the morning, I'd kill somebody. So, just try to keep it under 50 milligrams a day. All right, sweet. Okay, there's like 2 people still on Instagram. Hey, 2 people on Instagram. If you have a question, put it in the chat. I'll be happy to answer it. I think I'm all caught up, though. Yep, I don't see any new questions. So if you have a question, 3 people on Instagram. Sweet. All right, if you have questions, put them in the thing. And Giselle just put a question mark, so I'm not sure what that means. Let's see. What kind of diet is best to have while trying to conceive? That's a good question. And the gist of it is, wow, a jury just awarded $2 billion to somebody from Monsanto. I had some strange notification pop up. The best diet to have while trying to conceive, sorry. I've got like 6 screens going. I'm so overwhelmed. Is just a good, normal, healthy, well-balanced diet. You shouldn't do these diets that are excluding entire food groups. So a good example is keto. Keto is one that you don't want to do. And that's been associated with a higher risk of spina bifida. And we don't know if it's because you're completely avoiding folate in your diet because you're not having any of these fortified grains, or if it's something to do with being ketotic. Hey, Des, how's it going? I'm doing Instagram, YouTube, and Facebook all at once. It's a crazy Monday. I didn't have an afternoon in the office, so I'm just going nuts. But anyway, so you want to avoid these diets that are exclusive of entire food groups. Now, you should avoid fast foods. There's a study, at least one study, that showed that fast foods were associated with lower rates of conception. You should consider going organic with your fruits and veggies. There's a study from Harvard's Infertility group that looked at consumption of conventionally grown fruits and vegetables. So in other words, not organic. And there was a lower rate of conception in that group. And that probably has to do with residual pesticide exposure from the conventionally grown fruits and veggies. So go organic. Don't go keto. Otherwise, and don't eat a bunch of fast food, and you're probably fine. Good question. All right. Allie J. 1.5 years postpartum. PCOS is getting worse. Can we treat you? Yeah, no, we totally can do that. Your gynecologist can treat you for PCOS, no problemo. So, good question. And I don't know what these things are. Questions from your reviewers will show up here. I don't know what that's about. I see questions in the chat. I'm still learning on Instagram Live. So, okay, let's see. Questions. Here we go. Birkenbag, hey there. Period getting lighter, like more spotting, not sexually active, not pregnant. One question is, are you taking birth control pills? Because they'll make your periods lighter. But are you on any other hormonal method of birth control? If you're not, let me know. But if you are, that's probably what it is. That's the quick and dirty answer. All right. Let's see what else we got here. I don't know what. I haven't messed a lot with Instagram, so I don't have another question right now. So I'm just kind of like goofing around waiting on somebody to ask a question. So ask a question, you guys. Otherwise, you're going to get crazy things. I don't even know what this is. Like that, some kind of weird bubbles are going by. That's weird. Okay, we'll stop that. That'd be annoying. Let's see. Mandy, here's a question. Thank you, Mandy. I would still be goofing around. Okay, and Allie's got a question too. Is there a way to cure ovarian cancer completely or still be able to have children after being treated? Yeah, that's a tricky one. So the way that you cure ovarian cancer completely is to remove the ovaries and a hysterectomy. So kind of hard to have kids after that. Now, you will occasionally have somebody who has a well-differentiated stage 1 grade 1 ovarian cancer that is, premenopausal, wants to preserve fertility, where you could just remove that individual tube and ovary and you follow them very closely until they're done having kids, and then you take it all out. So it's surgery, it's chemotherapy, it's a big deal if it's really ovarian cancer. It's not one that typically you're going to have kids after, unless it's a very rare, kind of very early detected stage 1. Mandy, if one type of birth control causes you to have high blood pressures, will they all? Camrys was just a birth control pill. That's an estrogen progesterone birth control pill. So you'd want to avoid estrogen. There is that progesterone only pill called Micronor. That's totally fine. Or use some other progesterone only method. So either like a Mirena IUD or one of the other hormonal IUDs, or even just the copper IUD. There's no hormones in that at all. But you just want to avoid estrogen, Mandy, because that's what it's all about. So that's what, if there's anything that's going to raise your blood pressure in birth control, it's estrogen. So, but anything progesterone only is fine. Okay. Birkin bag, no birth control of any methods, but your periods are getting lighter. Yeah, I mean, as long as you're having them, I guess. So as long as you're having a monthly period, it's probably nothing to worry about. Mandy with a follow-up, will the progesterone only pills help with bad periods? Typically, yeah, it should still help. In fact, you might not have a period at all or much of a period at all on a progesterone only pill because they're continuous. So there's no break. So there's typically no scheduled period. Beatrice, have been my periods for 2 weeks. I wonder what's wrong. Is it normal? So to have a prolonged period, I kind of always go to is it the first time? Is it something that's happening frequently? So are you having periods every 2 weeks for 6 months or a year? Or is it one period that was a bad period? Because I kind of take the approach that like everybody's allowed to have a bad period every now and then, as long as it's not a consistently bad period, because then you got to do an evaluation. Do you have fibroids? Do you have some kind of bleeding disorders or something else going on that could be causing that? So hopefully that answers your question. Hey, people who are jumping on Instagram, if you have a question, put it in the chat and I'll answer it. This is what we're doing. It's just a live Instagram video. I'm answering questions on Facebook and YouTube, so I've got questions popping up everywhere. But if you have a question, put it in the chat and I'll answer it. Let's see, where are we? Caroline, I had a C-section 11 months ago to increase chance of VBAC. Yeah, you ought to put about 2 years between your deliveries. So you're getting pretty close if you're 11 months out from your first C-section. The evidence shows that you have a lower risk of uterine rupture if you wait 2 years between your deliveries versus less than 2 years. Now, it's not a huge increased risk, but there's some increased risk. So in an ideal world, if someone's asking me how long they should wait, that's the answer. All right. Let's see. Clarissa, what's considered high, dangerous third trimester blood pressure that would make you worry, want to induce a patient? Short answer is it depends. It depends on gestational age, chronic hypertension, on medication, 37 weeks probably. Somebody's 160s over 100s or higher, and you can't get them down with medication, then maybe it's sooner. Perfectly well controlled on meds, maybe even go to 39 weeks. So it kind of, it depends. And I know you're asking like what number. It depends on how many weeks gestation you are. It depends on if you're on meds or not. So those are the kind of variables. Let's see. Allie, do we offer the mother to have an at-home unmedicated? No. We don't have anything to do with home births. That's just not our thing. I'm sorry. There is some risk. If you look at the UK, like if you live in Great Britain, they do home births. But they have a system in place. They have midwives that are trained and have experience, and they have protocols and all this in place. And they're very careful with their patient selection as far as who can have a baby at home versus in the hospital. And, basically none of those things exist in the U.S. We don't have the infrastructure. We don't have the experience. We don't have the training. So we don't support home births at all because there's nothing we can do to help. So, yeah, I mean, if you live in the UK, it's a whole different thing, but not here. Okay, let's see. Alana, just thanks for the feedback. Watching from Europe. Cool. Where are you watching in Europe? I had somebody on here earlier from Ghana, And Birkenback says, UK, most women don't get epidural. It's expensive. Yeah, it's interesting how, cost drives medical decisions. There's not any real evidence from a medical outcome standpoint that epidurals are better or worse in terms of birth outcomes. They don't increase or decrease your risk of C-section. They may slightly increase your risk of operative vaginal delivery, so like needing to have a vacuum or forceps delivery, but not by much. So it is interesting that cost ultimately does sometimes drive these decisions. And in the UK, where the government's paying for your health care, you don't get an epidural because it costs too much. I guess you could probably pay for it out of your pocket. That'd be what I would do. I would totally have an epidural every time. But that's just me. Let's see. Okay, people are just jumping on and watching on Instagram. If you have questions, guys, put it in the chat, and I'll be happy to answer them. If you shout loudest, you can get an epidural, but lots if women deny. That's funny. So you have to be the person who yells loudest in the UK, and then you'll have your epidural. Let's see. Tanya says, chronic pain ever since you had a miscarriage. 4 different OBs says nothing's wrong, but frustrated. Pain's on your side. Yeah, I mean, it's hard to know. It's hard to make a diagnosis over YouTube about something like that. But sounds like you've been checked out by a few different people. Nobody's got any great ideas. I'm assuming you've had ultrasound. And it's hard to know without much additional history really what else to suggest. But, just kind of talking like in general, chronic pain, not wrong at some point if you've ruled out all other things that you think it might be, to consider like a laparoscopy to go look inside and just see if anything's going on. It may have nothing to do with the prior miscarriage. Maybe that's so that's not wrong to think about. If you've had an evaluation, the kind of like when you just think about like how do you evaluate pelvic pain in general, the way that I think about it is sort of very systems oriented. So, is this pain that comes with your period or not? Because you think about, well, could this be endometriosis? Is this associated with anything else, any urinary symptoms? Are you having any diarrhea or constipation? If any of those things are going on, then you do think a little bit about maybe some other organ system. So that's kind of how I think about it, just really in general, broad terms. Feel it more during ovulation. Yeah, that's pretty common. And if it's only during ovulation, it's probably normal. It's probably just what we call Mittelschmerz, which is just ovulation pain. It's fairly common and in and of itself is of no consequence. So I think Taylor's chiming in, ask for a referral to see a specialist. Oh, sorry, hang on. Pause. I had to call there on Instagram. That's funny. Okay. So I think I answered that. Goodness. Okay, still going. Sorry, I got phone calls there. What are the dangers of exercise and sports while pregnant? The short answer is really, it's more about the activity itself than being physically active. So there's lots of data that physical activity in pregnancy is a good thing. That physical inactivity in pregnancy reduces the risk of your need for C-section. Because you probably are less prone to gain too much weight, for example. So that there's some definite benefit there. There is evidence that you may do better in labor. Labors may be a little bit shorter. And that probably, again, has to do with the fact that it's a physical event, being in labor. And so if you're in good shape, it's probably going to go better. And I've seen that with my own personal experience. So it's more about the activity itself. So, things that make you prone to fall, like maybe you shouldn't go for a bike ride in the 3rd trimester down the mountain, because if you fall, obviously that could injure the baby or injure the mom. Probably shouldn't play, contact sports where you're likely to get hit in the belly or something, because that could be a problem. Sports where you're going to have to cut laterally, side to side real fast, more prone to ligament injuries because you're hyper flexible when you're pregnant and you're more prone to like a ligament strain. But aside from those kind of things, being physically active in general, definitely a good thing. And sort of any kind of cardio type deal is good. And so Katie's jumping on that question, just saying, is there more danger to exercise while pregnant if you've had recurrent pregnancy loss? No, there's really no evidence of that. So I don't tell my patients who've had miscarriages not to be physically active because there's just no data that that's the case. So I don't worry about that. Let's see. Matthew Price just recently had second C-section, 7th baby. I was advised before last not to have more. Given explanation, is there? I don't know. I wasn't there. It's hard for me to say. Other than you were risking your life, I don't know. That's kind of a weird story. I would go back and ask them specifically, like, well, in what way am I risking my life? Like, what was it about this C-section that was so unusual? Because, I mean, people have C-sections all the time. So what's the big deal? I don't think there's enough information in that comment to go any further with what I'm thinking, but that's the gist of it. Allie says, so your OB told me that running while pregnant can shake your baby to death. This is totally untrue. That's the craziest thing I ever heard in my life. There are a lot of studies of trying to think of the right word, like competitive athletes in pregnancy, marathon runners, triathletes, you name the sport. There's no evidence whatsoever it's going to increase the risk that's going to shake your baby to death. That's crazy. So yeah, I wouldn't worry about that. Okay. I'm all caught up. Thanks for the thanks. Yeah. Everybody's just kind of chilling over on Instagram. Nobody's asking a question. If you guys have a question, throw it in the little chat here. I'm just answering them as we go. Hey, Clarissa, let's see. Had a friend told not to vacuum after 35 weeks because the cord could wrap around the baby's neck. No, it's crazy. You're still working, by the way. That's good. Keep working. No. Nope. Allie, is it true you carry a lawyer? No. I like these yes-no myth questions. Oh, sorry. Yeah, Burkerbag 09 had a question. Miscarriage risk for women over 40. Your friend's 42, wants a second baby. It's higher. So the risk of miscarriage is higher with advancing maternal age, primarily related probably to increased risk for chromosomal abnormalities. So everybody knows what Down syndrome is, but there's a bunch of other ones, and a lot, even Down syndrome, a lot of those babies, actually miscarry. So yes, the risk is definitely higher. It's probably at least 10 or 15% higher than the risk of, say, a younger woman. So yeah, it's a little higher. Danielle, what can I do for painful varicose veins? I'm sure you meant varicose veins. Yeah, there it is. In the groin, they're really hard to fix while you're pregnant. Sorry. Afterwards, you can get, vein treatments. And even though and they can inject the veins in the vulva, so they can put sclero stuff in there, and that will treat it. So you can see the nice folks downstairs at Mindful Medical, and they'll hook you up. But not while you're pregnant. Sorry. Friend had recurrent miscarriages. Yeah, it's the age thing's not helping her for sure. Let's see, Clarissa, what are your thoughts about jumping on a trampoline in your third trimester? Yeah, I mean, it's probably not the best idea. You could think of jumping on a trampoline. I mean, I guess it'll depend on how hard you're jumping, right? But let's say you're really going at it and you're really going up and down. Well, I mean, that's not much different than falling, right? Because there's this sudden deceleration when you hit the trampoline, and then there's a sudden acceleration when you get thrown back up in the air. And that could cause some issues with, say, the placenta. So I'm not sure I'd recommend jumping on a trampoline, which is different than what Allie was asking a minute ago about running, which is a whole different thing than like bounce on a trampoline. So yeah, I wouldn't recommend that. That could cause some issues. All right. I'm all caught up, you guys. I've got 3 different live streams going, and nobody's asking me a question. So if you have a question, put it in the chat somewhere. Instagram, YouTube, Facebook. We're going nuts today. Triple live stream. Probably go for another 5 or 10 minutes. So if you guys have a question, put it in the chat. I'm trying to fix this. Got a lot of dropped frames on YouTube. Are you guys seeing on YouTube, is it looking really jumpy? Let me know. Let me change the stream rate, see. I don't think it'll let me output bit rate. Okay, if I crash YouTube, sorry. I'm trying to change the stream rate. See if that does a better job. What's the most rewarding part? It's all about delivering the baby. That's the best. That's the best. A little jumpy. Let me know if it gets better. I'm changing the stream rate to see if that helps. I can't tell. Looks like it's getting better. Oh, my wife's walking behind me trying to get the dog maybe. Let's see. Laren. Hey, Laren. No, it's preferred to lay on the left side, but is it dangerous to lay on the right? No, it's not left versus right. It's don't sleep on your back. So there's a study that showed moms who are back sleepers. What are you doing back there? I don't think you can see them on any of these cameras. No. The thing is, don't sleep on your back, Laren, because there's studies that show you have a higher risk of stillbirth. Wave to everybody. Hey, dear, you're on the live stream.
Oh, me?
Yeah. You're right behind me.
I'm trying to get the
You
dog.
can see yourself right there. There he is.
The
There's Chance. You can see him on Facebook. You can't see him on YouTube. There he is on Instagram.
Okay.
There's the dog. That's Chance.
Can't get him on the other
He's
one.
being good. No, I see. Look right there. See? There he is.
Yeah.
There's Chance.
Around.
He's being pretty good today. He's not barking.
There he is.
All right. That's Chance and my wife.
Hello.
I think I'm caught up there. Let's see. What on Clomid, 50 milligrams, metformin, 500, 5th day of the month. On the 5th of the month. No period so far. What should I do? So I typically would recommend maybe consider doing a follicle check to see if you're actually responding to the Clomid, which I would typically do on cycle day 10 to 12 and see if you're responding. And if it doesn't, then we may need to increase your dose of Clomid, for example. So there's a video on my YouTube channel called How to Take Clomid or Femera, so maybe check that out. And I talk about it in a lot of detail on that video. So check that out. Lori says, positive OPK, day 13, now 16, 17, still getting positive. What does it mean? It doesn't mean you're pregnant. It's way too early for that to pick up. I don't know why you're still picking up LH surge, but it doesn't mean you're pregnant yet. Impact of stress when trying to get pregnant. Short answer, we don't know. It is not well studied. Oh, hey, and Instagram is going, it's got like a countdown till it cuts off. So there must be, and it may keep going. So if it jumps off, it'll jump back on in a minute. I don't know. We'll see what happens in a minute and 45 seconds. So we're talking about stress. Yeah, there's no evidence that increases your chances of being more difficult to get pregnant, that kind of thing. Clarissa says, fall asleep every night, wake up a few times on your back. What is it? Why is it bad? So, well, and the interesting thing, before I answer the why is it bad, is that the more times you wake up at night, the lower your risk of stillbirth, and that's why it's bad. So we know that moms who are back sleepers, so moms who preferentially sleep on their back, like you fall asleep on your back, have a higher risk of stillbirth. And so that's why it's bad. So I recommend trying to figure out a way to sleep on your side, like prop yourself up with a pillow so that you've got some tilt. But, beyond that, the interesting thing from that study I'm quoting you was that the more times you woke up at night, the lower the risk of stillbirth. It's probably because you rolled over. So probably if you were on your back and you woke up and you rolled over, that reduces the risk. And the question is, well, why is that associated with the higher rate of stillbirth? It's thought to be related to how the placenta is perfused. So when you're flat on your back, your uterus probably compresses the vena cava, which is what returns blood from your legs back to your heart. And that is compromised when you're flat. So when you get on your side, and it's compressed by the uterus. So when you roll over on your side, the uterus kind of gets off. That's weird. Pause, dude. Live video ended. Hang on. Instagram just died. I got to get it going again. Should you be taking fish oil? Yeah, it doesn't hurt, but the evidence is not clear that it really increases the outcomes. So that's the bottom line. Hang on, I got it. I'm gonna turn the Instagram back on. Instagram. Oh, that's it, man. Instagram just shuts you down after an hour. You're done. Okay, well, see you later, Instagram. So anyway, then follow up on the back sleeping business was, can you lay on your back to watch TV but not sleep? It's probably not as bad. Although if it was me, I'd kind of be like, try to be on your side anyway because it's not going to hurt. That's the gist of it. What can you do for tingling in your hands at night? It's probably carpal tunnel, which you get a lot of. So, those wrist splints you can wear. You can get them at any like Walgreens or whatever, and they keep your hands just straight like that, so that you're not doing a bunch of this when you're sleeping, because that's probably compressing the nerves that run right through here in your wrist, and that's what causes tingling in your fingers. So wear those kind of splints at night when you sleep, and if it's really bad, then you can get a steroid injection in your wrist. Excuse me, and that helps. There's a really good hand specialist in town that we can hook you up with if it's a persistent bother. No other symptoms of carpal tunnel, well, other than the tingling in your hands, I think. So, yeah. Pretty sure that's what it is. Okay. Yeah, that's the main symptom, tingling. I think that's probably what it is. Yeah, I think I'm caught up. Sweet. Let's see what we got on YouTube here. Can you get your AMH, FSH, etc. tested while breastfeeding? You can. It's going to mess with your FSH for sure, and your LH probably. Interestingly, AMH, and I made a video about this on the YouTube channel you're watching me on right now, is not predictive for pregnancy outcomes in spontaneous pregnancies. In other words, if you're not doing in vitro to get pregnant, AMH is not a good test. It doesn't predict anything. We used to test it all the time to see what people's ovarian reserve was, and it just turns out that it doesn't predict it doesn't predict your chances of getting pregnant, is the short way of saying that. So, yes, you can. It may mess with the results somewhat, so I'd wait till you weren't breastfeeding, but the real question is, should you do them at all? Because they're not terribly helpful. Unless you're doing in vitro, that's a whole different story. Let's see, 21 weeks, anemic, having trouble with prenatals with iron, stomach pain, throwing up. Well, it's not that the lack of iron is going to hurt the baby. The main thing is that if you're anemic, when you have a baby, you're going to have some bleeding. And so, if you're anemic to start with and then you have excessive blood loss, you can get in trouble in a hurry. So if I have a patient who is anemic and is not able to tolerate oral iron, then I'll do IV iron. And that's effective. It's safe in pregnancy. I do it all the time. Mostly because we just don't want a mom to get so anemic during, after delivery that they wind up having to have a blood transfusion. So we're trying to avoid that. So that's what that's about. Let's see. Jenny, should you go see your primary care? Talk to you about it next week? Yeah. Or can you and I talk about it next time? Yeah, either way is fine. But I would try the wrist splint things first, and then try them between now and then. And if it's not getting better, we'll get you referred to a specialist, and she can inject you. Do you recommend whooping cough vaccine during pregnancy? Yeah, we do. About 28 weeks, we do it routinely. And the reason is we want the baby to benefit from your immunity. So by getting a booster while you're pregnant, your antibodies are going to cross the placenta, and the baby gets protection. So that's what that's all about. See, Larry, one more thing about laying on the right side. When you're in labor at the hospital, why would his heart rate drop on the right, go back on the left? Yeah, who knows? That's labor is a whole different game. That can have something to do with epidurals. There's all kinds of reasons why that might be. And sometimes babies just like one side better than the other, and it could have something to do with where the umbilical cord is, or who knows. But that happens all the time. And so that's very common in labor. baby's having some decels, the nurses are flipping you back and forth trying to find out what the baby likes best. So that's kind of a different story. Okay. I think we're out of questions. We've been streaming for an hour and 5 minutes. Holy cow, that went by like a blink. So thanks to everybody who's been watching. If I missed your questions, sorry. You could post it in the comments and I'll try to answer them later maybe. Do these about once a week, not always on a Friday, often on a Friday, but I had a weird free Monday afternoon, so here I am answering your questions. Thanks to everybody who watched and who put questions in the chat because I have nothing to talk about otherwise. Check out the YouTube channel if you haven't already. I know people watching on YouTube have. But if you're on Facebook and you haven't checked it out, jump on Facebook and just Google Wesley Davis MD, or my screen name is Wes D Ski. And we have Instagram for Circle of Life. You may not know that. I think it's just called Circle of Life Women's Center. Yeah, it is. And I just did a live stream on there while we were talking as well for the first time. So we're going to have some more stuff going on that account. I'm trying to get a little better social media presence going on Instagram too. So if you haven't, go check it out. Go follow it. Go whatever it is you do, like it or whatever. There's going to be some giveaways and stuff between the Facebook page and the Instagram page. So check them out. Thanks again to everybody who has watched and chatted. And thanks to everybody just for being you. See you guys. Bye.